In adult scoliosis, the size of the curve is just one of the factors that determines the severity of the scoliosis. When we look at adults with scoliosis, there are many factors that influence the likelihood of a curve progressing or getting worse and the likelihood of a curve causing pain. The size of the curve is just one of those factors. It's important for you and a healthcare provider to understand all of the factors involved that indicate the likelihood of a curve progressing, how likely it is for a curve to cause pain, and most importantly, how likely it is for a curve to impact the quality of your life. So without going to someone that knows how to do a detailed and accurate assessment of your scoliosis, you're probably going to get inaccurate information, inappropriate recommendations, which ends up leading to get inappropriate or ineffective treatments. And ultimately, that can lead to your curve progressing and impacting the quality of life. Now, the research is clear. Many adults would benefit from getting treatments earlier on when their curves are smaller and more flexible compared to when the curves get more severe and there's more degeneration and stiffness starts to set in. But the reality is many providers don't understand this. They don't know how to properly look for all the risk factors for a curve progressing, so they don't give patients the right recommendations early on. In many cases, if caught earlier, would have a much better impact or much better quality of life later on. So just to get an idea of how many risk factors a provider really needs to look at and understand, let me review some of the biggest risk factors or predictors of scoliosis curve progressing and causing pain. So these are some of the factors that influence the likelihood of a curve progressing. 1, the size of the curve. If a curve gets beyond 30 degrees, it has an increased chance of continuing to get worse. And if it gets beyond 50 degrees, it 100% is going to keep progressing and getting worse. If you have a lateral listhesis greater than 5 millimeters, I'm going to show you and clarify what that is, but it tells us there's some instability in the spine. The location of the curves. Curves in the low back of the lumbar spine or in the thoracolumbar spine have a higher risk of progressing and progress at a faster rate than curves in the thoracic spine when we're looking at adults. That's important to know because it's the exact opposite when we look at kids. Sacral obliquity. This is an unleveling of the sacrum and pelvis. We can see that right here, and I'm going to further review that in just a couple minutes in this video. L4 or L5 end plate angles. That is the angle of a couple of vertebrae and how tilted they are. I'm going to show you an exact example of that later in this video. L5 intercrescent line. This also tells us how stable it is, and I'm going to further clarify that later on in this video. Coronal or sagittal imbalances, how far someone is shifted to one side or if someone's starting to get a large forward lean. Thoracolumbar kyphosis, or the loss or potential loss of a normal curve in the lower spine. And spinal rotation, how much the spine is rotated at the peak of the scoliosis curve. So those are just 9 things, and there's more, but those are just 9 of the key things the provider has to really look at and assess to determine how stable your spine is and how likely it is to progress, and they need that information to recommend the right treatment. When we look at adults with scoliosis, most of the time adults are actually under-prescribed treatment early on, or they're prescribed ineffective treatments that have no likelihood of slowing the progression of the curve. Things like pain medications or spinal injections or general chiropractic or general PT, although they may provide relief, they can't actually address or stop the progression of curves. So let me show you a couple of cases, and I'm going to show you how a skilled provider could have picked some things early on that could have likely reduced the likelihood of a curve progressing. So in this first case, this was a 50-year-old woman that presented to her primary care doctor with chronic low back pain. Now, when you look at her spine right here from the front, it looks straight. Most providers would say, hey, there's no real risk of curve progressing or a scoliosis from developing. But a skilled provider would look at this and say, hey, there's something called a sacral obliquity. I mentioned that in the previous slide. That's when someone's pelvis or sacrum is unlevel. So if you look at this, you can tell the patient has a short leg over here on this side. If you drew a line straight over, you can see this leg is shorter, and that is causing the pelvis to tilt. So the sacrum, the bone that the spine sits on, is unlevel. If you build a house on an unlevel foundation, you're going to have a crooked house. If we look at these vertebrae, there's already a little bit of rotation started, and we can tell that because this right here is the spinous process, the bone you feel in the back of your spine. It's in the dead center down here in the lower spine. But over here, you can see it's more here. So there's already rotation beginning to develop. This was the patient just 5 years later. And you can see at this point, she has developed a degenerative de novo scoliosis or a new scoliosis in adulthood. I believe if this was picked up and the patient was given a proper screw lift to level off her sacrum and she wore that, this likely would have not happened. Now, another thing about adult scoliosis is some cases can progress much faster than people expect. Let's take a look at one case that progressed at an extremely rapid rate. So this is a patient that first came in 2011. She had a 26-degree scoliosis. Now, cases like this, a lot of times people would think would progress anywhere from 1, maybe up to 3 degrees worse per year. But from 2011 to 2012, her curve actually went from 26 degrees to 45. It actually progressed 19 degrees, much faster than most cases and what pretty much anyone might predict this to progress. Now, I believe if this person would have got treatment early on in 2011 with a custom brace worn part-time and some scoliosis-specific rehab, that this rapid progression could have been prevented. Now, if you're watching this and you have not already downloaded our free guide on adult scoliosis, be sure to click on the link below and get that free guide. Now, let's dive into some of the key factors we need to look at to actually assess the severity of scoliosis. Now, one of the most important things we have to look at in adults is what we call balance, or coronal or sagittal balance. So when we look at this is done through photos and x-rays. You can see this patient when viewed from behind, she's really leaning or tilting to one side. When we look at her from the side in this, she's really starting to lean or hunch forward. This is an indicator that she is coronally unbalanced, and she has a few compensations in her body. One, you can see her hips are shifting over to the right and her spine is tilting to the left. You can see a big gap between her arm and side here. This one's pinned and her arm is lower here. When we look at her x-rays, this green line is the central sacral line. So it's a line straight up from the center of her pelvis, and you can see how far she's shifted over. Now, when this gets greater than 4 centimeters or 40 millimeters, that's a high predictor for chronic pain, disability, risk of curve progression, and risk of falls and loss of balance. Similarly, when we look at the spine from the side, we can see this patient is shifted forward here. There's a few other things she's doing to compensate. She's bending her knees, her pelvis is tilting back, she has a loss of the curve here, and her body's leaning forward. When we look at her spine from the side, this is where her lower neck or upper back should be, where this green line is, and you can see how far forward she's translated. She's really leaning forward. Now, when we look at adults, a large anterior sagittal balance like this, specifically if this also gets over 40 millimeters or 4 centimeters, that's actually the #1 predictor of having chronic back pain and disability from low back pain. It's also a high risk of curve progression and scoliosis. It also increases the risk of falls from loss of balance. There's something called the cone of equality. And what that means is the more your body's in an upright or aligned position and you're more imbalanced, the less energy it requires for your body to maintain itself in an upright position. The more you lean to one side or the more you hunch forward, the more energy that takes your body just to maintain an upright position. And it's also associated with pain and risk of falls. Really important things to address when we're looking at older populations. Now, a second key thing to address or assess when we're looking at severity of scoliosis is actually the size of the curve when measured on an x-ray. But frequently this is measured inappropriate or providers don't understand what those numbers mean. So let's take a look. Now, when we look at x-rays, how we measure scoliosis on an x-ray is something called the Cobb angle of measurement. And what we do is we draw a line from the most tilted vertebrae at the bottom and the most tilted vertebrae at the top. So if we look at this, you can just look at the angles of these vertebrae and how tilted they are. Now, if we measure up here, this is the most tilted here, and if we select this vertebrae, the curve comes out at 56 degrees. But if we select the correct vertebrae, the curve comes out at 72 degrees. My point is, the provider has to know how to properly measure the scoliosis degrees so you actually understand what you're dealing with. Now, when we look at scoliosis, if a curve gets beyond 30 degrees, like I previously mentioned, you have an increased likelihood of a curve progressing. This is important because if we catch curves early on adulthood or adolescence, a lot of times our goal is to reduce that curve size to below 30 degrees. Also, when it gets over 30 degrees, you have an increased risk of it causing other health problems and reducing your overall quality of life. Now, if it gets over 50 degrees, your spine will 100% progress. You're almost certainly going to have other health problems associated with that scoliosis, and it's going to reduce your quality of life, and you're probably going to have disability related from pain from that scoliosis. Now, if you know you have scoliosis and you're thinking to yourself, how severe is my spine? What should I be doing? Click on the link below and request a free discovery call. That's going to give you a chance to talk to me about your individual case, and I can tell you the severity of your curve, how likely it is to progress, and what treatment options you may be a candidate for. Now, lastly, I want to quickly address a few other risk factors, things that are high predictors of pain and curve progressing, things that a lot of providers miss, but to a skilled practitioner, they're very obvious and they're really critical to understand and properly evaluate. So let's take a look at a few of these risk factors. One of those is a lateral vertebral listhesis, or a lateral slipping. You see that right here where the vertebrae is slipping off to the side. I'm going to show you an example of that. That tells us the ligaments that are holding the spine upright, they have given out. The spine is now unstable and it's likely to keep progressing. Another one is the L4, L3 end plates. It's the angle of these two vertebrae, how tilted they are. When they get really tilted, you have a high risk of pain and curve progression. Inner crescent line, I talked about that. I'm going to show you that on an x-ray. It's when the spine sits higher in the pelvis, it's less stable. And decreased lumbar lordosis, a loss of the curve from the side, or a reversal of that, increased thoracolumbar kyphosis. And I'm going to show you an example of that too. So let's take a look at this. That L3, L4 vertebral body angles. So if you look at this, this is L5, this is L4, this is L3. You can see these vertebrae are real tilted. And if I draw a line on that end plate, you can see L3 is pretty tilted and L4 is even more tilted. That tells me that this person is likely to have chronic pain, it's likely to impact their quality of life, and a curve like this is likely to progress without proper treatment. Another one is lateral listhesis. So let's take a look at this zoomed in x-ray. This is L4, this is L3. You can see the edge of this bone right here, and then you can see the edge of this bone right here. And you can see this bone is translating off to the side. That tells us the spine is unstable. The ligaments that hold the spine up are giving out and they can no longer maintain the body in proper alignment. This is a high predictor of pain, but mostly that this curve is gonna progress without the right treatment. And then that L5 inner crescent line that I was talking about that you're probably confused on. So let me show you. These are your sacral iliums. This is your sacrum, this is the L5 vertebrae. If we draw a line straight over like this, you can see that actually intersects the L5 vertebrae. That tells us that the spine sits pretty high in the spine. Most of the time it actually intersects right here, so the spine should sit lower. So to understand how this impacts spine stability, imagine that you have someone that's really tall, really skinny, standing up on their tippy toes. They're gonna be pretty unstable and easy to push over and move around. Now compare that to someone that's short, they're squatty and they got a nice wide stance. That person's gonna be more stable and harder to move around. So what that means to you is the provider can look at that and understand how unstable a spine may be and know that that's also a risk factor or a predictor of curve progression. And the last thing I wanna talk about is when you get a loss of lumbar curve or a kyphosis developing. So let's take a look at this spine. This is a normal lumbar curve from the side. Normally over here, the curve should be like this. The curve should be like this. This is the front, this is the back. This one is actually reversed. So there's not only a loss of curve, it's completely reversed. And if you look at the whole spine, that's because the person is actually translating or leaning forward. They have that big anterior sagittal balance. When we look at them from the side, this is also a person right here. You can see their body's leaning to the side. They're out of balance this way. This is where their body should be, and this green line is where they are. So a loss of that curve from the side, and when they're out of balance or tilting over, a couple of examples that we talked about earlier. Now, by the way, when someone has this person's also gonna have chronic pain, probably some radicular symptoms. It's gonna bother them when they get up to walk. They're not gonna be able to walk or stand for very long. So that was a lot of information, but it gives you a better idea of how thorough of assessment someone should do to accurately determine the severity of your curve, how likely it is to progress, and what treatments you're a candidate for. Now, if you're an adult with scoliosis, you've likely tried several things, you're getting mixed information. So to take the confusion out of everything, click on that link below and set up a free discovery call. I can review your case with you one-on-one. I can tell you how severe your curve is. I can tell you if you have any of these risk factors for curve progression or severity, and what the best or most appropriate treatments are for your individual case. And now that you better understand how we properly assess the severity of scoliosis, the next thing is you have to understand what are the most effective treatments for scoliosis in adults. So click on the link over here to watch our next video where I deep dive into the most effective non-surgical treatment options for adults with scoliosis.